Hello everyone, hope so all of you are fine and welcome to my channel. Today we will discuss about weaning. What is the process of weaning, what is rapid shallow breathing index and how it is calculated, and what are the criteria for weaning. First of all, weaning is a process of removing the patient from respiratory support. There are three criteria for weaning. If the patient meets these criteria, then we will perform the weaning of the patient, and if the patient doesn't meet these criteria, then we will never perform the weaning of patient. There are three criteria: number 1 clinical parameter, number 2 mechanical parameter, and number 3 biochemical parameter. Clinical parameter includes that whether the clinical condition of patient is improving or not, patient is cooperative and alert or not, and the patient is able to clear his secretions or not, means the patient is able to cough or not. There is any abdominal distension or disturbance, patient is cardiovascularly stable or not, and we will also look for prolonged immobility. Also, the respiratory rate of patient should be less than 30 breaths per minute. Now we will discuss about mechanical parameter. For mechanical parameter, we will have to calculate rapid shallow breathing index, which is calculated by allowing the patient to breathe through spirometer. Spirometer has 3 tubes and balls. We will ask the patient to inhale the room air and then blow out in the spirometer, and then we will check the tidal volume of the patient. The minute volume measured on spirometer is divided by respiratory rate to give an average tidal volume. Then the rapid shallow breathing index is calculated by dividing the respiratory rate by tidal volume in liters. If the rapid shallow breathing index is greater than 100, then we cannot do the weaning of the patient, and if it is less than 100, then the weaning of the patient can be done. This is the mechanical parameter of the weaning. Also, the patient's vital capacity should be more than 15 ml per kg, and maximum inspiratory mouth pressure is more than 20 cm H2O, and minute volume is less than 10 liter per minute. Now we will discuss about biochemical parameters. Biochemical parameters, in biochemical parameters, normal pH, patient should have normal pH and normal partial pressure of carbon dioxide. Partial pressure of oxygen should be more than 8 kilopascal or 60 mmHg, or no more than 40% oxygen and 5 centimeter PEEP. Now we will discuss about problems which may cause difficulty with weaning. First problem is impaired ventilatory drive. Second one is cardiovascular insufficiency. Third one is electrolyte and nutrition problems. Fourth one is pleural effusion or pneumothorax. Then lung parenchymal fluid or infection, upper and lower airway incompetence, obstruction or secretions, and chest wall abnormality, instability, and respiratory muscle weakness. That was all about our today's lecture about weaning.